Hey, future RN. Heart anatomy is one of those basics for the NCLEX that's just so important. You really need to know the chambers, the valves, the blood flow, and the layers to truly understand big conditions like heart failure and murmurs. Honestly, this is the foundational knowledge that's going to make everything else just click into place. Welcome to ClearPath NCLEX, your go-to for high-yield content that helps you pass on the first try. Okay, let's dive right in. We're going to focus on one central question today. What is the heart's most critical pathway? And I promise by the end of this, you are going to be able to trace the path of blood through the heart with total confidence. You've totally got this.
So, let's start our little tour of the heart with its basic blueprint. We're going to cover where it lives, about how big it is, and the key landmarks you absolutely need to know for your clinical practice.
So, the heart sits right in the middle of your chest in the space called the mediastinum, and it's tucked safely right there between the lungs. It's positioned just a little bit to the left, and of course, it's protected by the sternum. And here's a great way to picture its size. It's about the same size as your own fist. Pretty simple, right?
Now let's talk about how the heart is actually oriented. It's not really shaped like a Valentine's heart, It's more like an upside-down cone. So the wider top part is called the base, and the pointy bottom is called the apex. And listen, this is huge for clinicals. The apex is where you're going to find that point of maximal impulse. That's where you listen for the apical pulse before giving certain cardiac meds. This is a favorite on the NCLEX. All right, now that we know where the heart is, let's kind of zoom in and explore its walls. We're going to look at the three distinct layers, moving from the outside in. So the heart has three main layers. The outer layer is the epicardium, which is like its protective covering. The middle layer is the myocardium, and this one is the real star of the show. It's that thick, powerful muscle that does all the pumping. And then the smooth inner lining is the endocardium. That's the part the blood actually touches as it flows right through the heart.
Okay, now let's go inside and meet the four powerful rooms of the heart, the chambers.
So the heart has four chambers. I want you to think of it like a two-story house. The top two rooms, or the upstairs, are the atria, the right atrium and the left atrium. Their whole job is to receive blood coming into the heart. The bottom two rooms, the downstairs, are the ventricles, the right ventricle and the left ventricle. These are the powerful pumps that push the blood out of the heart. Okay, so why is the left ventricle so much bigger and more muscular than the right one? Well, it's all about its job. The right ventricle only have to pump blood right next door to the lungs, which is a really short, low-pressure trip. But the left ventricle, it has the massive job of pumping blood to your entire body. We're talking from your head all the way down to your toes. It needs that thick, muscular wall to generate enough force to get the job done.
Okay, so we have our rooms. But how do we keep all that blood from flowing backward? Well, that's where the valves come in. Just think of them as the heart's perfect one-way doors.
And here is a super simple mnemonic to help you remember the first two major valves in order. Just think, try before you buy. The tri stands for the tricuspid valve, which you run into first on the right side of the heart. The bi stands for the bicuspid valve, which is also called the mitral valve, and that one comes second over on the left side.
So in total, there are four valves. You've got the atrioventricular, or AV valves, the tricuspid, and the mitral. They separate the atria from the ventricles. And then you have the semilunar valves, the pulmonary and the aortic. These guys guard the exits from the heart. Blood flows through them in this exact order. First tricuspid, then pulmonary, then mitral, and finally the aortic valve.
And now for the main event. It's time to put all the pieces together and trace the ultimate journey of blood through the heart. This is the pathway you absolutely 100% need to know. So let's walk through it, step by step.
Let's start with the right side of the heart. So deoxygenated blood comes from the body and enters the right atrium through the vena cava. It then passes through that tricuspid valve into the right ventricle. From there, the right ventricle pumps it through the pulmonary valve into the pulmonary artery, which takes it to the lungs to get oxygen. Now for part two of the journey. That fresh, oxygenated blood returns from the lungs through the pulmonary veins and into the left atrium. From there, it goes through the mitral valve into the super powerful left ventricle. And finally, the left ventricle pumps that oxygen-rich blood through the aortic valve into the aorta and out to the rest of the body.
So let's simplify that. The entire right side of the heart deals with deoxygenated, or blue blood that needs to go to the lungs. And the entire left side deals with oxygenated, or red blood that's ready to go out to the body. It really is a perfect two-pump system. This is a core concept you will see again and again.
And there you have it. You've got the heart anatomy basics down, and this slide is a fantastic little cheat sheet of the complete path. This knowledge is your foundation for understanding heart failure, valve disorders, and so much more on the NCLEX. Go ahead and take a screenshot of this if you need to.
Great job! You've heard the information, and now it's time to put it to the test with Section 4, our NCLEX practice drill. Let's see what's stuck.
Question number 1. Which valve is located between the right atrium and the right ventricle? Go ahead and pause and think for a second. The answer is the tricuspid valve. Remember our little trick? You try before you buy. It's the first AV valve the blood goes through.
Question 2. Blood enters the heart from the body through which major vessels? Take a moment. The correct answer is the superior and inferior vena cava. They are the large veins responsible for collecting all that used, deoxygenated blood and bringing it back to the heart.
Okay, question 3. Which chamber has the thickest muscular wall? Think about which one has the hardest job. It's the left ventricle. And the reason is simple. It needs all that extra muscle power to generate enough force to pump blood to your entire body, from your head to your toes.
Question 4. What is the thick, muscular layer of the heart that's responsible for contraction called? Think back to those layers we talked about. The answer is the myocardium. Just remember, myo means muscle and cardium means heart. It's the heart muscle.
All right, last practice question, number 5. Which valve prevents the backflow of blood into the left atrium? Think about the left side of the heart. The answer is the mitral valve, which is also called the bicuspid valve. When that powerful left ventricle contracts, the mitral valve slams shut to make sure blood only moves forward.
You did an awesome job on those questions. Now let's wrap everything up with Section 5, our final review. Think of this as your personal NCLEX heart anatomy cheat sheet.
This slide right here has everything you need. Seriously, pause and take a screenshot of this for your study notes. You've got the order of the chambers, RA, RV, LA, LV. You've got the order of the valves, tricuspid, pulmonary, mitral, aortic. And a fun mnemonic for that is try pulling my aorta. And then you have the main flow and the reminder that the right side is deoxygenated and the left side is oxygenated. It's all right here for you.
I promise you, if you can master this fundamental anatomy, you are going to unlock a much deeper understanding of all those complex cardiac conditions you'll see on the NCLEX. This is truly the bedrock of cardiac nursing.
So let's end with a thought to take with you. Now that you know the perfect flow of blood, how would just one single faulty valve, just one door that doesn't close properly, disrupt this entire efficient system? This is where anatomy meets pathology, and it's the key to thinking like a nurse. If this explainer helped you, please give it a like and subscribe for more high-yield content, and hit that bell so you never miss the next one. You can do this.